This segment is sponsored by Golden Triangle Internal Medicine and Geriatrics.
Hey, Southeast Texas, thank you for joining me for another edition of Ask the Doctor. This is Dr. Levine of Golden Triangle Internal Medicine and Geriatrics. We do have one question for today. When diagnosing a disease, which test seems better, a blood test or a biopsy? That's a pretty good question, and if you do go to the doctor or the hospital or the emergency department, you are familiar with some of the testing that can be done to help doctors and practitioners figure out what is wrong with you. We're all familiar with getting the needle in the arm. We're all familiar with x-rays, such as a chest x-ray, or sometimes a procedure called a biopsy, which is basically a small procedure, can be done in the office, sometimes has to be done in the hospital. And basically we take a surgical section of the specimen, whatever it is, and look at it under the microscope to see exactly what it is. Typically a biopsy will be done of a growth or a mass or some sort of tumor that's seen on x-ray or even seen with the naked eye. Could be on the top of your skin as well, and sometimes we just don't know what it is unless we take a piece of it and look at it under the microscope, and that's a biopsy, typically a very small section of whatever we're curious about. So you don't always need a biopsy. A lot of the times blood work, just the simple things that we do in the office, such as a CBC or a chemistry or even a PSA, can be done just with blood. So it just sort of depends on what disease we're trying to diagnose. Some diseases can be diagnosed with blood alone. Some diseases need a biopsy, blood, and an x-ray. So it just sort of depends, but we do use those modalities to help us figure out what is going on. Typically, we can get to a conclusion with one or all three. If you have any other questions on Ask the Doc, give us a call. We'll see you next week.